Should we start, ma'am?
Yeah. Atul, do we start now?
Yeah,
Yes, ma'am.
yes, you can start.
Okay, yes.
Good evening,
Go
ma'am.
ahead, Priya. Yeah.
Hello all, good evening. A very warm welcome to everyone to this webinar. I'm Dr. Priya Mishra. I would like to start off the webinar by thanking all of you for taking the prestigious time to participate today in the webinar. We will discuss about the holistic approach to the PCOS, about a very, very important topic now these days. It's hard to explain to someone who has no clues. It's daily struggle being in pain and feeling sick on the inside while you look fine on the outside. It's just PCOS. We are so delighted that we have today a very, very great teachers to us with us who will discuss and share their experiences and give some throw some light on a holistic approach on the PCOS. Let's take a moment to introduce our guest speakers.
Ma'am, please unmute. Please unmute, ma'am. You are muted.
Dr. Priya,
Priya.
you're muted.
I welcome to Dr. K.D. Nair, sir. He is a senior consultant and HOD. He has received award ASRM 2020 and 21. He is senior consultant and HOD in Akansha IVF Center, Mata Chanan Devi Hospital, New Delhi. I also welcome Dr. Professor Surveen Bhuman Sindhu, madam. She is director and head of the Department of IVF and Reproductive Medicine Center, MEX, Multi-Speciality Hospital, Panchshil Sakri, Delhi, Gurgaon, and professor of School of Health Science, Sansal University. There are numerous awards to her name. That is important are Foxy Non-Zone UA Award in 2004, Distinguished Service Award IMA 2015.
I think we can cut that short.
Yeah. We request Dr. K.D. Sir and Dr. Surveen to give a welcome address. Dr. K.D. Sir.
Yeah, good evening, everyone. I welcome you all to this webinar being organized by SIG Holistic Medicine. This was one of the special interest group we created when we took over the holistic medicine. And if you look at the current scenario, holistic medicine is being effective in all the specialties, whether you name it cardiology or orthopedic rehabilitation or infertility or PCOS. The talk today is on holistic medicine in PCOS. And one of the main fundamental of PCOS is the lifestyle modification. And I think most of the speakers are going to talk about it. And with Dr. Rajvi Mehta there, we are going to have a wonderful session about the holistic medicine, how the patient can be benefited from performing the various procedures under holistic medicine. I welcome you all, Dr. Rajvi Mehta, Dr. Ritu Jain, Dr. Shalini. They are going to give you a big input. And after the end of the webinar, we all will be more knowledgeable about the holistic medicine, how it can be used for PCOS, which is one of the most common conditions we see in our OPDs. So we have to be aware what all can be done. And that is what we look forward to. Thank you, Dr. Shalini, for calling me.
Thank you so much, sir. Dr. Surveen, few words of wisdom from your side.
I would just say that there is so much to holistic medicine, and you have brought out such beautiful webinars on it. And this is yet another one really well thought of on PCOS and holistic medicine. Big congratulations to the holistic medicine SIG, Rajvi, Shalini, and Ritu. And it is very great joining hands with chapters, because that's how the word spreads. So Prakriti, I think that's a great thing to have you on board with this SIG. We hope that you can take this webinar chapter to chapter, because I'm sure it's going to be a very well thought out, very well talked webinar. And very few people really pay too much of attention to holistic medicines. Patients walk into our clinic and we are so busy treating them with all our allopathic drugs that we actually forget that there is a total medicine there without drugs which can help a patient much more than probably pumping her with all the hormones we do. So again, big congratulations and thank you for having me.
Thank you so much, Dr.
Thank you so
Surveen.
much, ma'am. Myself, Dr. Sushma Mama, Treasurer, IFS Chhattisgarh Chapter. Ma'am. It's wonderful to have you here, ma'am. Rajvi, ma'am,
Yes.
I think you must be remembering me.
Of course, I do know you have been there.
I took embryology training from your.
I know.
Thank
Yes,
you.
yes. Thank you.
Good evening, everyone.
Good evening.
Hi, Dr. Sushma. Good evening.
Hello.
I guess few words of pearls of wisdom from Dr. Rajvi about our webinar.
So firstly, I would like to thank the IFS, KD sir, Dr. Surveen, and the IFS Chattisgarh Chapter, Dr. Prakriti, Dr. Sushma, for joining hands with us on this webinar on PCOS and holistic health. You know, a couple of decades ago, PCOS was just a textbook thing. We barely saw any cases. And when we started seeing more cases, it was presumed that vaginal ultrasound has come and we are possibly seeing more. And I'm talking of the late 80s, early 90s. And today, the extent to which PCOS pervaded our society is so immense that even children in the 12th standard are aware of PCOS. And obviously, there's something that has happened in the last couple of decades, which has brought this syndrome, spread it across the world. And it appears that one of the major causes could be the environmental changes and the lifestyle changes that have occurred. And if that is the case, we need to really identify what it is and how we can, to some extent, reverse it. So that is the reason we are taking up this, this series of webinars. And as Dr. Surveen suggested, we would like to take it across to various chapters across the country to build awareness amongst the public, amongst the doctors, that small changes may bring about a big effect. And maybe, as Dr. Surveen is always very keen on research, if we could start documenting this and maybe showing it, I think it's a big way forward. So I'm really looking forward to the talks and very happy to share that in the last 2 years, we have a couple of papers coming up on lifestyle and PCOS from the Indian groups. So over to you, Dr. Priya and Dr. Prakriti, for a few words. And thank you once again for joining hands with us.
Thank you so much, Rajvi ma'am. And I welcome all of you on the behalf of IFS Chhattisgarh Chapter and SIG Holistic Medicine. Today, our plan is to give some holistic approach for the PCOS patient, because PCOS is a very complex disorder that can be managed but not permanently cured. So each woman has her own symptoms and its own causes. A number of medications are prescribed to women with PCOS. However, a holistic approach could be a best way forward in managing a disease as complex as PCOS. It is a physical, sexual, and psychological and social syndrome. Therefore, approach to be care beyond treating physical symptoms. The main goal of the approach is improvement in weight and energy issues and regularization of the periods. So by holistic approach, there is definitive improvement in the quality of life of the PCOS patients. So I again welcome Dr. KD sir, Dr. Surveen ma'am, and our SIG holistic members. So now we will start the program, and I'll over to you, Priya.
What are the impact of lifestyle factor on the infertility? So I invite Dr. KD Nair sir to give us enlightened with the knowledge, and Madam Ritu Jain madam, she is a consultant and director of Vardhaman IVF, ICSI and Laparoscopy Center, and Dr. Prakriti Verma madam, consultant and director of Vardhan Festive Baby Center, Bilaspur, Chhattisgarh.
Should I start, Dr. Prakriti?
Yeah.
Yeah. Good afternoon, everyone. Friends who have taken the special time out to listen to this very, very important basis of all the diseases. And thank you, Dr. K.D. Sir and Dr. Surveen to choose this as one of the SIG group, because as we dig more into it, we find so many things, and Dr. Rajvi is really helping us to take all this forward. So does my lifestyle really affect my fertility? This is a question which may or may not even, come to the young generation mind. Apart from the thought, there are so many factors which have surrounded women of reproductive age that they do not get only time to think about all these things. A couple of reproductive age is all the time surrounded by pollution, chemicals, illicit drugs and pharmaceutical products, smoking, drinking, disturbed circadian rhythm, so much of stress, eating disorders, obesity, improper eating habits, and other STDs. And not only this, the life has become altogether sedentary. There is too much of caffeine consumption to carry on the work. The work temperature at the workplace usually the working hours are long, and all girls and boys, they wear tight under clothes and tight clothing, jeans and all for many days. The nutrition value has really gone down. Consumption of drugs and alcohol and tobacco has increased. More so, anxiety and depression has leaped into our lives. So all these factors have basically affected the circadian rhythm and HPO axis. All the time we're surrounded by electromagnetic radiation. One cannot find a single person, even a school going person, without phone. And of course, computers. So, and also there is endocrine disrupting compounds in the form of personal care products, pesticides, which are affecting our food and food chain, which is leading to steroid hormone disruption, and endocrine functions are altered altogether. Let us have a look in them one by one. So we are living in the world of micro and macro plastics. The minimum human equivalent dose of microplastics leading to abnormal semen parameters is 0.016 milligram per kg per day. Although the inhalation daily is 0.5 to 7.737 nanogram per kilogram per day, but the effect is cumulative, and it is children who are more exposed. So by the time they reach into adulthood, there is already so much of damage. Not only air, but water is also polluted with microplastics. Is it a revolution or a plastic pollution? A point to think. Now, these microplastics and nanoplastics, the studies have shown that in pregnant mice also, they lead to reduced testicular weight in the offspring. They destroy the reproductive epithelium and reduce the sperm count. This was a study by Huang et al. In 2022. So this is not affecting this generation. This is affecting the future generations also. So fertility is going to be declining in the next gen also. So what are the causes of infertility in microplastics? It leads to oxidative stress, disruption of HPA axis, decreased energy production, the mitochondria are damaged, microcirculation is damaged, the quality of sperm and function is decreased, so DFI increases, and seminiferous tubules are damaged. This has been shown well in a study by Hu et al. In 2021. It also leads to atrophy of the testis and increased apoptosis of the sperm. It leads to apoptosis and decreased sperm formation. So it is now coming on to heavy metals in female. Copper, chromium, manganese, and zinc, they are essential and they are good at low concentrations, but at higher concentrations, they are toxic. And also the metals like cadmium, mercury, lead, they do not have metabolic roles, but they are toxic at all the concentrations, and they are found especially more in industrial towns. It alters the gene expression. It modulates the epigenetic mechanisms, especially the microRNAs. The chronic exposure leads to steroidogenic dysfunction and embryotoxicity. And of course, they act as endocrine disruptors. Now, what about seafood? There is high level of mercury in this, which correlates with the pathologies like PCOS, endometriosis, premenstrual syndrome, dysmenorrhea, breast disorders, abnormal lactation, and amenorrhea. Well, zinc is something which is good, but zinc deficiency is there in all the junk food, and it can negatively affect the oocyte maturation and cumulus expansion, and the meiotic arrest can happen. All the industrial towns, they have been studied by Yu and Zhang that shows that particulate matter more than 2.5 impaired the sperm quality as well as decreased fertility by 2% per 10 microgram per meter cube. So as the particulate matter increases, we all know that it affects the process of embryogenesis, more failure in implantation. What about smoking? It leads to dysfunctional folliculogenesis, thick zona pellucida, more apoptosis of the granulosa cell, hence follicular depletion, basal FSH rise, and less number of oocyte. Smoking actually evokes the inflammatory response, increase ROS formation, and it also acts as endocrine disruptors in both male and female fertility. Not only it affects the current population, but it also affects the genetics in the next generation. So whatever these mutagens are there in the atmosphere, be it plastic, be it electromagnetic radiation, they have their impact in the, they have transgenerational effect. So pesticides, this Bancozeb is a fungicide which is used as an aerial spray to protect these fruits like grapevines, apples, bananas, and all. Even at lower dosage, it can lead to dysfunction in the mitochondrial function. So it is embryotoxic. Now, endocrine disruptors like phthalates, whether they are short chain or long chain phthalates, they are used in PVC products, and by REACH also, all these have been qualified as highly toxic substances. And where are they used? They are used in day-to-day products used by the females like dyes, lipsticks, nail polishes. So parabens, benzophenols, bisphenol, and phthalates, also they are cytotoxic, not only for germ cells, but also for the other cells also. We are surrounded by all these pollutants and endocrine disruptors. So they affect basically the folliculogenesis right from the primordial follicle to primary, preentral, and entral. So if, can we really eliminate them altogether? I think that is something we have to think. It is not possible. Now, coming on to EDCs, taking further EDCs leads to PCOS and endometriosis, and it has been leading cause of polycystic ovarian disease, because now the younger generation, right from the school girls, they start using these makeup products, and high BPA level have been found in those who are users of these products. So there is a possible link. It leads to early it leads to apoptosis of the ovarian follicles as well as sperm cells. It leads to imprinting. It affects the essential developmental regulatory genes, and it is obesogenic also, and it disrupts the normal metabolic activity. It affects the reproductive, neurological, immune, endocrine system, and has adverse developmental effect. It leads to male infertility by epigenetic mechanisms and disruption of the HPO axis and steroidogenesis. So there is increased sperm damage on all those who are exposed to EDC. So what is happening actually, all the genetic component of male and female, both is being affected. Not only this, these all are obesogens, and how obesity is increasing in females and metabolic syndrome is occurring in both males and females. So this affects the fertility. We all know in males and females, obesity has led to an epidemic of infertility. Now, cell phone usage then laptop, microwave oven, radar, all these, are they really toxic for the sperms? So there are, and this data is really conflicting, because I will take you through the presentation. So does it really cause infertility? Well, some studies show that it leads to morphological changes in the oocyte. It affects the differentiation of oocyte, folliculogenesis, and decrease reserve or reduce fertility. Now, what is the radiation which affects the ovaries? It is usually 20.3 gray at birth, and as the age increases, the less radiation also is damaging, like 14.3 at 30 years. But this study in 2021 by Zhang Yu et al., this showed that mobile phone radiations are damaging in males as well as in mice females also. It leads to decreased sperm quality and in both humans as well as in mice. But what is this cell phone radiation? It is the radio frequency in different ranges of phone is different. Like 2G, 3G, 4G, it had frequency in the range of 0.7 to 2.7. Whereas the fifth generation 5G cell phones, they have the frequency up to the spectrum of 80 GH. So can it damage the DNA? The point is that they are all in the non-ionizing range. Whereas the ionizing radiation like X-ray, radon, cosmic rays, they are the one which cause increased damage to germ cells and cause cancer. There was a study by the European Parliament in a research health impact of 5G released in July 21, which said that commonly used radio frequencies like 450 to 6000 megahertz or microhertz are probably carcinogenic in humans and can affect male fertility and development of embryo, fetus, and newborns. And it affects at different levels, the follicle, the structural, functional change, leading to more degeneration of follicles, damage to endometrial tissue, change in the reproductive hormone, change in the sperm morphology, quality, and function. So according to this European study, there is effect of 5G radiation at all level of germ cells in the whole journey of spermiogenesis and folliculogenesis. Now, can we come out of this eating habit, which is so much prevalent nowadays? Well, the answer to all these is leading a simple life, eating the yogic sattvic food and having balance of energy, calorie intake, balance of calorie intake. Just a minute. And expenditure. So in other words, the life was led by our ancestors, the simple living and quality eating, we have to restore to that. For PCOS especially, and to avoid obesity, we should restore to medical nutrition therapy, that is resorting to eating more of whole grain cereals rather than white grains. We have to have combined food of carbohydrate, protein, and fat. Low GI grains should be used. More of millets should be used. Barley, cracked quinoa, buckwheat. And total number of calorie consumed should be proportionate to the energy expenditure. 1200 to 1400 calories at least should be taken. And one should not diet too much and avoid ketosis. Salad should be used more in diet, salad and fiber, but that should be washed very, very thoroughly to avoid the effect of pesticides. Butter to be replaced by avocado, tahini or nut spread. Olive or canola oil in cooking should be used. 8 to 10 cups of non-caffeinated liquids or low carb intake should be low on dairy, low on polyunsaturated fats, mainly monounsaturated fat should be used. Omega-3 fatty acids are good, and replace salt with herbs if possible. Small frequent meals, mixed plate, protein at all meals or snacks, and healthy beverages should be there, which can be fat-free milk or fortified soya beverages instead of drinks and colas. There is a role of anti-inflammatory diet. In fact, whole Indian diet is anti-inflammatory. The traditional diet, which used spices and herbs, lentils, methi seed, flax seeds, honey, amla, carrot, cucumber, broccoli. So the old time diets is actually anti-inflammatory diets. We use more and more fried and these junk foods that is inflammatory to gut. And we know nowadays there is a link of gut microbiota with the uterine microbiota, and that also affects the implantation. So not to take much time, the again the diet should be the healthy one, and one has to avoid the sweetened beverages, high sugar foods, sweeteners, sweetened sauces, high fat foods, refined grain, trans fat, and refined oil. And recently there was news of link of carcinogen with sweeteners. We all know that. Yoga has a great role. Dr. Rajvi has really highlighted that in many these webinars. Pranayam, Kapal Bharti, Anulom Vilom, Ujjayi, Ocean Breath, Nispand Bhav, and Shavasana. Different poses are there for different problems. So actually it releases the stress. It has a dual action and also increases the muscle usage, and hence the better utilization of glucose. And what we give in PCOS, myoinositol and dichiroinositol combination, if we do daily exercises and strenuous exercise, definitely it is the same result as if we are taking medicine from outside. And it has reduction in the central fat, it improves the insulin sensitivity, reduces the LH level to the tune of 39%, and 33% fall in the insulin levels. So this was a very big study. And ADA, American Diabetes Association, has given some guidelines for the PCOS patient: 130 minutes of moderate to high intensity exercise, or 90 minutes being aerobic with high intensity, distributed all 5 days, and it should be persistent activity. There should not be gap of not more than 2 days, and sedentary life has to be replaced by walking and running. And it is the persistent and continuous activity which brings a change, not 1 or 2 days. Like one day may aap challo 150 minutes and say it is done for a week. That doesn't work. So the whole change can be done only by reversing our working patterns, our eating patterns, and putting regular exercise in our schedule, and restoring the HPO axis will definitely restore the fertility. Thank you.
Thank you, Dr. Ritu, for such a comprehensive talk. You have covered everything: diet, yoga, and how the environmental pollutants are affecting infertility. May I request Dr. KD sir to give his expert comments?
I think Dr. Ritu has done very well. She explained what all to be done. It's very easy to speak. The changes in the diet, changes in the exercise, changes in yoga. I think we will have now to bring it in our everyday, day-to-day life. We should be doing the diet changes in our houses itself. That we should not complain later on that we have to reduce the sweets, we have to reduce the junk food. We make it a habit. Household itself. So that is how when we can, because the incidence of PCOS, if you look, it is increasing tremendously. Around 25% of the patient, right from young adults to age group, and even perimenopausal suffering with PCOS, and which has a long-term effect on many other systems, not only on infertility, in cardiovascular system and metabolic system. So we have to be careful. If we can bring out this change in our thinking, basically you have to change your thinking. That you have to bring this type of food, you have to eat this type of food, you have to do that much of exercise. If you mention about yoga, you can do it at your home without spending any money, but you have to have the thinking. The most important is to change your mindset. You have to bring the thinking, and then you can probably take care of the PCOS problem. That is my perception, that you have to, everybody has to change in the thinking process. We all talk change in the diet, change in exercise, change in this, but we have to implement it in our day-to-day life. That will become a part of our everyday life. That is all.
Thank you so much, sir. And Dr. Prakriti?
Yeah. It was very nice and elaborative talk regarding the lifestyle factors affecting infertility. And we all know that there are nowadays almost of the young people and even at the age of 35, 45 also we are using junk foods, and smoking, alcohol are the main causes of this. So as madam told us that we have to choose the yoga and meditation so that it will give relaxation of the mind, and stress factor will be gone. And thank you so much, madam, for a nice talk.
Thank you. I think it is more of millets which should be included, and the local grown foods and seasonal food should be taken.
Yeah, sure.
Thank you.
Thank you so much, Dr. Ritu. Dr. Priya, you can invite Dr. Abha.
Now we have Dr. Abha Majumdar, madam. She really doesn't need any kind of introduction, but I'll tell you that she is consultant and director and head Center of IVF, Human Reproduction, Sir Gangaram Hospital, New Delhi. Along with her, we have Dr. Shalini Chawla Khanna, ma'am. She is senior consultant IVF and laparoscopic surgeon, Max Hospital, Delhi and NCR. And Dr. Anuradha Chaudhary, madam. She is director of MMR Hospital and Reproductive Medicine in Raipur.
Thank you so much, Dr. Prakriti. So, are my slides visible?
Yeah.
Okay. So I would be talking about a very, very common topic, which we all clinicians see in our OPDs. Every second or third girl walks in our OPD saying that she has PCOS. Either they come as self-diagnosed or their mother comes and it's the Google knowledge, which basically they are imbibing. So let's solve certain myths and facts about the PCOS. Now, PCOS, we know, polycystic ovarian syndrome, is the most common endocrinopathy of the reproductive age women. The prevalence is 8 to 20% in the general population, and it is the commonest cause of anovulatory infertility. The etiopathogenesis or the etiology is complex. It's genetic, which is also polygenic. Not only a single gene is involved, but many multiple genes are involved, and the presentation is clinically very diverse. These patients, they present either with amenorrhea, means I would be little this thing because I think it's a public forum, there would be general people. So I would be explaining little terms in the technical terms a little bit also. So either the girls would be presenting with amenorrhea or oligomenorrhea, means that she doesn't get periods or she get delayed periods. She has signs of hyperandrogenism where it could be manifested by acne, hirsutism. These again could be the signs of insulin resistance. She could be obese. And then when we do an ultrasound, we see the polycystic appearance of the follicles. And later on in the later stages of life, she can even present directly with the endometrial carcinoma. So as per the Rotterdam criteria, which we all clinicians usually follow, we have 2 out of these 3 features. So any of these 2 features are present, we diagnose them as the polycystic ovarian disease. However, if there is an oligo or an ovulation, which means that either she gets scanty periods or she doesn't get periods, along with the signs of clinical or biochemical parameters of hyperandrogenism, then ultrasound is not necessary. Now, coming to the myths, most of these girls or these mothers, they come that, have I done something wrong that I'm getting PCOS? The mothers are really worried right at the young age. So the fact is that it is heritable in 70% of the cases. Now, this part, you can't do anything about it. So you don't have to blame for the hereditary part. And like if the mother has PCOS, then the incidence of girl having PCOS would be 20 to 30%. If it is in the sister, then she is likely to be in the category of 40 to 50% to have PCOS. And there is actually an interplay of many factors in the pathogenesis of PCOS. Like there is an interplay of neuroendocrine, hormonal, metabolic, genetic, and environmental factors. And this process starts right in utero. I mean, the programming and the neuroendocrine factors starts right in the utero. Then during the puberty and the adolescent, there are inflammatory factors, environmental factors. During the adulthood, there is an androgen exposure, and during the pregnancy, they might aggravate. So all this is the etiopathogenesis. So just to highlight that it is not only the hereditary, which you cannot control, but the environmental factors, as Dr. Ritu very well highlighted, the environmental toxins, the diet, this all we can control that. So another myth that coming to the adolescent diagnosis of the polycystic ovaries, that ultrasound is a must for adolescent to diagnose adolescent PCOS. No, the fact is that in young adolescent girl, the oligoanovulation and hyperandrogenism, which can be presented by like hirsutism, acne, virilization, alopecia, if these two signs are present, signs and symptoms, then this is good enough to diagnose a young girl as PCOS. Ultrasound is usually not taken as the diagnostic criteria in a young adolescent girl, especially till 8 years after menarche. This is by the international evidence-based guidelines, also by Teddy et al. Because in young girls, in young adolescent girls, the ovarian reserve itself is very high. They have a good number of follicles. So we would be biased when we are seeing a young girls. I guess all the clinicians present here would agree with me that we see many young girls coming to us that she has PCOS. They get the ultrasound done and the radiologist or maybe the friends and all, they write that it's a PCOS. But yes, we have to be very particular about it. If it is mentioned on an ultrasound, if it is a young 13-14-year-old girl, then probably we have to relook at it once she is 8 years after the menarche. And so this is oligoanovulation, hyperandrogenism must, and ultrasound is not needed. Now again, AMH, we all are using right, left, and center in our infertility OPDs. Now, is AMH alone is sufficient as a marker of polycystic ovarian syndrome? The fact is that anti-Mullerian hormone, it's a marker of ovarian reserve. It guides us about the number of the follicles in the ovaries. However, it is too premature to use AMH alone as a surrogate marker to diagnose the polycystic ovarian syndrome. And again, the international guidelines also do not say any criteria that AMH can be taken alone as a diagnostic for PCOS. Again, it's a myth that polycystic ovarian PCOS affects only the overweight women. The facts are definitely that obesity and PCOS are interlinked. Obesity can make PCOS symptoms worse. 38 to 88% of the PCOS women, they are either overweight or obese. However, up to 30% of the women with PCOS, they are thin and lean. The insulin resistance can be high as 6 to 22% in thin lean PCOS. So obese patient, we usually tend to diagnose them early. However, they usually, they can be diagnosed in high school because they are presenting with obesity or irregular cycles or amenorrhea. But the thin lean women, they are usually diagnosed late, and they usually present with the hyperandrogenism, where there's a predominance of the male hormones, and they are usually present with acne, unwanted hair growth, hair loss. These thin lean are diagnosed that way. Or they might not, or they come at a stage when they are finding it difficult to conceive. So it is a myth that it is present only in the obese. The fact is that PCOS is present both in the obese and the thin lean, however, more common in obese. Another myth that serum insulin is a must to diagnose PCOS. Now, the facts are that definitely, I also said it in my previous slide, that insulin resistance and PCOS, they are interrelated. Definitely, there is an insulin resistance, which is the pathology, main pathology, and the reason for the presentation or for the causes of the PCOS. However, measuring serum insulin is not a must. There are surrogate markers, like if there is a waist-hip ratio more than 0.85, or there is an acanthosis nigricans. I have shared a picture of the acanthosis nigricans, which is just the brown velvety spots at the back of the neck, or signs of hyperandrogenism, they do suggest that the patient could be having high insulin levels or insulin resistance. So, and these are again the international guidelines, which says that insulin level is not to be, it's not a must, but the 75 grams OGT is recommended to assess the glycemic status, where the BMI is more than 25 or it is more than 23 kg per meter square in Asian population. If there is a history of impaired glucose levels, impaired glucose tolerance, or family history of diabetes mellitus type 2. And moreover, these guidelines, they do suggest that they should be offered in all women with PCOS when they come to us in the preconception period, when they are planning to conceive, so that once they conceive, the side effects because of the hyperglycemia are less. So we should be, I mean, our strength and this thing should be to measure to do the OGTT, and which would help us in guiding the further management. Another myth, that if your menstrual cycles are irregular, you have polycystic ovaries. Many girls come to us thinking that delayed cycles, delayed no periods, they are labeled as PCOS. No, we carefully have to evaluate and rule out the other causes of the irregular cycles. Like the normal cycle length is 21 to 35 days. However, if she has some thyroid disorder, if she is breastfeeding, if she has hyperprolactinemia, or extreme dieting, over exercising, stress, or the pathological causes like Cushing syndrome, late onset congenital adrenal hyperplasia, or the pathological causes like the pelvic inflammatory disease, uterine fibroids, and polyps. So all these factors, we have to keep this in mind, and not just we cannot label every girl with irregular periods as PCOS. Again, that all acne are because of PCOS. Many in our OPDs, in our general day-to-day OPDs, many patients are referred to us from the dermatologist. Once the acne is there, these girls, they go to the dermatologist, and then they are being referred to us, maybe to start the birth control pills. So these are the cutaneous manifestations of PCOS, like acne, hirsutism. Acne alone is present in 20 to 40%, and hirsutism in 50 to 80%. Now, there is a difference in the acne in the PCOS girls and the acne vulgaris. The acne in the PCOS usually is because of the hyperandrogenism. There could be along the menstrual irregularity care could be there. These girls, they do not respond to the conventional therapy. When we do the biochemistry, there would be increased level of DHEAS, DHT, and androstenedione, and this testosterone. And moreover, this clinical picture very clearly shows that there is a distinction. However, this line is very thin. But in general, the PCOS acne, it appears along the jawline, along the chin, and on the upper neck. Now, coming to the acne vulgaris, this usually occurs in the 80% of the adolescents. Majority of them, they remit before the third decade of the life. Their androgen levels are normal, and they can occur at any or part of the face or the body. So they are usually more on the cheek. However, there's I again would stress that there is a very thin line in PCOS because of the PCOS, and PCOS because of the non-PCOS. Again, coming to the alopecia. Alopecia is also very commonly seen in the PCOS patients. Now, again, very thin line of differentiation. In PCOS patients, this temporal, there is a bitemporal recession and thinning at the vertex. And however, the frontal line is maintained. Whereas in the non-PCOS alopecia, where the other causes could be there, then it is a generalized. It is in the central part of the scalp as compared to the bitemporal recession in the PCOS. So that's how we distinguish. And then we have to see whether it is the PCOS is the cause or the non-PCOS is the cause. Again, that if you are PCOS, you cannot get pregnant. No, the facts are definitely, we all know that PCOS is the commonest cause of anovulation and represents 80% of the anovulatory cycles. At the same time, 30% of the women, they do ovulate intermittently. And the first step is the lifestyle modification, where we ask them to do regular exercises, keep themselves fit, because it improves the blood circulation. It reduces the androgen levels and thus help. And along with the diet also, less sugary and fried and less of junk diet. So if she doesn't conceive with the lifestyle, then we can give the ovulation induction drugs, beginning with the oral drugs. No response, go to gonadotropins carefully. If no response, ovarian drilling, if she's being posted for laparoscopy for another reason. If still no response, then IVF is the third line. So many patients, they come as, even in the young girls, they come as a panicky that I will not be able to conceive. So it's a lifestyle modification which you have to guide them, and then they can conceive. So again, myth that if you're not looking to get pregnant, you don't have to worry about PCOS. No, absolutely wrong, because PCO is just not about the regularity of the periods or getting pregnant. There are long-term side effects, which we call it as the metabolic syndrome disease, where it could be hepatic steatosis, glucose intolerance. She's at increased risk of diabetes mellitus 2 in Asian population. By the time, if she's uncontrolled, by the time she reaches 40 or 50 years, she has as high risk of 2 to 6 times the risk of diabetes mellitus. Then there could be dyslipidemia, hypertension, cardiovascular symptoms. Along with that, then there could be sleep apnea, depression, anxiety, eating disorders, and endometrial carcinoma. So be careful. It's just not about getting pregnant. It's about the long-term good quality of life. It can be controlled by birth control pills. But yes, before giving the birth control pills, I would say that she has to restore to the lifestyle modification, which comes as a first healthy diet, physical activity, which I highlighted, and losing as low as 7%. It helps in regulating your menstrual cycles and helps in ovulation and spontaneous pregnancy. The birth control pills beyond 24 months in adolescence, we still need to look at it. However, in a young age, I mean above 20s or 30s, it can be used for a longer. And then if she's not keen for a contraception, if you're just looking for menstrual irregularity, then tablet Meprate is just good enough. And that just 2 for 5 days, starting from day 21 of the cycle. Now, this was an eye opener for me. Like, we all tend to use this thing, the diane, which is like the ethinyl estradiol, and where the progesterone component is the cyproacetate. However, the international guidelines do not recommend this as the first line, because there is an increased risk of venous thromboembolism. So the normal birth control pills like the Novelon, the Femelon could be as the first line instead of diane. And again, very important controversial topic, that metformin is to be used in all PCOS women. Absolutely not. Metformin has a very specific role. Yes, it is a wonder drug, and it works beautifully in those patients where the BMI is more than 25 kg per meter square for the management of weight, or where it is a high metabolic risk group like diabetes, impaired glucose tolerance, or high risk ethnic group like we Asians are a high risk group for the the PCOS. Again, we start with the lower dose and then increase it up to 1500 to 1700 grams. Or if there is a clomiphene resistance, then probably metformin can be added, and especially when the BMI is more than 30. This is again by the standard guidelines, the international guidelines for the PCOS. Just my last myth, that probiotics improve PCOS. Now, these days we are hearing a lot of these probiotics we are giving right, left, and center. Now, do they really help in improving the PCOS? The fact is that the gut microbiome, it influences the host defense mechanism, and the sex steroids, they modulate the composition of the gut microbiome. It is being proposed that in PCOS, there is a decreased diversity. That means the number of species of the microorganisms like bacteria, fungi, viruses, it is less. So that is the logic of giving the probiotics in these PCOS women. However, it is still a question mark. And till now, no data is being available for adolescents. However, we all tend to use it because they are good, they have antioxidants, but then the final guidelines are yet awaited. So with this, I wind up my talk, and I request Ava ma'am to give her expert comments. I'll share my screen.
Thank you, Shalini. It was a very, very nice talk. I'm so proud that you brought in all the important points. You had a very clear message to follow. And the most important is PCOS only comes to us when these girls don't conceive. So this is truly a myth that if you have PCOS, you will never conceive. So always when adolescents come, you have to just maybe educate their parents that don't jump to an infertility specialist, give her time. And if she's menstruating regularly or even slightly irregularly, she will conceive. So this is a very important myth to be busted, that only those reach us who do not conceive easily. Even those who are menstruating regularly may present as unexplained PCOS girls who are ovulating and yet not conceiving like other women. The other myths also were very important, which you busted right now. And the last one, which you said about microbiome, the gut microbiome is now being sort of looked into. We have millions and millions of microbes over our body and inside our body, and gut is a very important source. Just the lifestyle changes the microbiome to such an extent that possibly it addresses obesity more than PCOS. And hence, changing the microbiome by giving probiotics, or changing the vaginal microbiome by giving vaginal probiotics, all this is now under research, and maybe we will have answers to our queries, especially for obesity rather than PCOS. One more question I wanted you to bring into your talk about soy milk. A lot of people come and say, I have PCOS, told not to take soy milk. This is again a big myth, and I'm glad you said milk and soy milk and milk products are important for these girls. So it is important to know having PCOS doesn't mean that you will be infertile. And the last message, which was very important, that this is once diagnosed a PCOS, this is a lifelong condition and needs to be managed on its own merits lifelong. It's not just fertility. Even after fertility, the metabolic syndrome, weight, hypertension, diabetes, hyperlipidemia, and last of all, endometrial cancer has to be looked into, especially for women. We gynecologists are more concerned with endometrial hyperplasias, irregular bleedings. So if they have delayed menstruation with bleeding, which stops in 2 to 3, 4 days, and the endometrium is normal thickness, we are happy. But if we have delayed periods and then a bleeding which does not stop, we need to investigate these girls for hyperplasias and treat them for that. So excellent talk, Shalini. These are important things which we as gynecologists must keep in mind. Frequent periods, bleeding continuing for long periods. Please look for endometrial hyperplasia. And as young as 30-year-old girls, we have found endometrial cancers in PCOS women. And it is a lifelong process. So do not think the treatment or the management is over. I wouldn't say treatment. It's only managing these women, that they need to manage all what leads to metabolic syndrome. And OCPs are not even Diane, it is the general OCPs also, Shalini, which are said to change the lipid profile, and hence they are not recommended really. In fact, a progesterone withdrawal, and now it is a vaginal progesterone withdrawal for women who have completed their fertility, is a good option to continue with menstrual bleed from time to time, at least 8 periods a year. But this can happen only if the endometrium grows. If it doesn't grow, no progesterone will work for her. So excellent talk. If
thank you so much, ma'am, for your kind words. Really honored
nice.
to be present in front of you, ma'am. Dr. Priya, you can continue and invite for the next the talk.
I
No
think
question.
Dr. Priya is not here. She is having some network issue. So I think we should start the third session. I will invite Dr. Surveen Guman ma'am and Dr. Sushma Verma ma'am as a chairperson. And the next talk is de-stressing in PCOS, role of yoga by Dr. Rajvi Mehta ma'am.
Welcome, ma'am. Welcome again. And in our previous lectures, we had wonderful lectures about the diagnosis and myths in diagnosis, and about the treatment of PCOS, regarding the lifestyle modification, dietary modification, addition of micronutrients. But now we are going to have a lecture on very important topic, that is de-stressing role of yoga in PCOS by Dr. Rajvi Mehta. And it is a very important lecture, and we will all enjoy your lecture, ma'am. And welcome for the lecture. I invite you for the lecture. Ma'am, you are not audible.
Good evening, everybody. And on behalf of the SIG on Holistic Medicine and my co-conveners, I thank you all for joining. So the topic that I'll be speaking on today is de-stressing in PCOS and the role of yoga. Now, whenever a person, especially in cases of PCOS, or for that matter, anything, patients often ask, why is this happen? What is the cause? And very often when there is no answer, there is one answer, and that is stress. So, oh, the problem is because of stress, and stress is the cause of whatever that disorder is. But what exactly happens? Is there really a role of stress in PCO? And especially in this evidence-based world where we want a scientific explanation, a physiological explanation for everything, it is interesting to note that there are papers very recently published as much as this month, which talk about a link between PCO and stress. So they are assessing stress in terms of the stress hormones, and they find that the serum levels of cortisol and DHEA are significantly elevated in PCOS compared to healthy women. So the fact is, yes, the stress hormone levels are high, but does that mean that this is the cause of PCOS, or is this a result of PCOS? Then another study which showed about a possible link between stress related factors and altered body composition. And altered body composition is one of the major issues of PCOS, and altered waist to hip ratio, altered hormonal levels. And even in this study, it was shown that the stress hormone levels were found to be high, distinctly different in the two groups, and that stress could play a silent role in the pathogenesis of PCOS. Of course, again, like I said, is PCO causing stress or stress causing PCOS? So I would like to just draw your attention way back in time to Dr. Subhash Mukherjee. He was responsible for the world's first IVF baby following frozen embryo transfer. And it is in the 1970s where one really didn't talk about stress or didn't talk as much about PCOS as we talk today. He had seen this possible link, which we found in his notes, and he says that stress causes excess of ovarian and on the ovarian hypothalamus axis. It leads to the production of excess androgens, which we really know is one of the classical symptoms or hormonal abnormalities in PCOS. And then subsequently, because of there is a ovarian insensitivity leading to the failure of ovulation. And then again, he goes on to say that the stress leads to excess androgens, excess DHEA, excess plasma hormones, and this in turn leads to PCOS. So this was a hypothesis, unfortunately couldn't prove it. Now, having heard so much about PCOS, the question is, what is stress? Because all of us some point of time say we feel stressed, but what exactly is stress? So it is a state of mental or emotional strain or tension in the during any adverse or demanding circumstances. Now, this is such a subjective definition because people's perception of stress may vary. I may find that just having to find a taxi to work is very stressful. So is that stress? Or somebody is having some close family members recovering from the third stage of cancer or being treated? Is that stress? So everything is all based on perception of stress. So the fact is that when we're talking of infertility and PCOS, the line of what causes what, whether the cause and then effect are so closely interlinked. So first of all, there are the physiological causes because of the hormonal abnormalities. And imagine a young girl with hirsutism, acne, and at an age where appearances are so very important to girls. And if there is hirsutism, isn't it going to cause stress? Isn't it going to create stress on that young girl? Then irregular periods. I mean, if the periods become irregular, there is a cause for concern that is this going to affect my fertility later? and metabolic changes, which is again a classical sign of PCOS, accompanied by weight gains in a large number of people. And then the first thing that is told to women with PCOS is lose weight. Now, the question they come up with is that it is because of the disorder, because of the problem that I'm overweight. So if the problem is solved, weight would come down. And we would tell them that it is because of the overweight that is the problem. So lose weight and the problem will go. So it is the classical chicken and egg story. What comes first? What is the cause? What is the effect? Is the effect the cause? And is the cause the effect? So in this situation, we are really into a tangle that the endocrine disruption leads to weight gain. Weight gain leads to endocrine disruption because the fat cells start secreting estrogen, and these estrogen causes a negative feedback affecting FSH production and again affecting estradiol and the progesterone production. And the major component in this, which adds on to this cause effect thing, is the stress factor. So I'm not going into the classical understanding of stress, of the environmental stressors, but all in all these factors sort of contribute to the PCOS situation. So having said that, I would like to draw about one of the classical symptoms of stress. You know, when one is very anxious, when they're stressful, they say your limbs feel out of control, they're quivering up, you know, the mouth is drying, we feel stressed out, the whole body is trembling as the stress levels increase. An expression is the hair stand up, the skin is burning, and there is overwhelming sense of pity, eyes filled with tears and agitated and full of sorrow. Because we in today's generation feel that the stress levels are very high. We call it due to competition, due to demands from the women. Since we're talking of PCOS, or overall in this generation, we all feel that we are highly stressed. The question is stress unique to the last few decades and the last few generations? Were our parents and grandparents not subjected to stress? Or is it our ability to withstand stress, to perceive stress has altered? So a small thing feels stressful while, you know, possibly the previous generations. So is stress something new that we are giving so much of importance to? The fact is that these symptoms which I talked about stress, if I were to put it in another language and not the English language, if we were to speak about it in Sanskrit, it is said in the text, the Bhagavad Gita. This is what Arjuna tells Lord Krishna. These are my symptoms which I feel. And these are the classical symptoms of stress. So stress is not unique to this century, this generation or previous few generations. It has been there for time immemorial. But what has possibly changed is our ability to handle stress, our ability to perceive stress, and that may be leading to this whole cyclicity of abnormalities that are coming with stress. Now I bring the third component. So we talked about PCO, which my previous speakers have beautifully highlighted. We talked about the whole concept of stress, and then what is yoga? So yoga basically is a science of the mind and consciousness. It is something which we deal with. Today, yoga is so popular across the world that you meet every second person, everybody would have heard about yoga, even if they haven't done it. And if you ask these people what is yoga, each has their own explanation. Somebody will say it is meditation, sitting calm and quiet. Somebody will say yoga is all about, doing various postures. It is challenging. Somebody will say it's all the Surya Namaskars that we do. Somebody will say it is breathing exercises or pranayam. Friends, the fact is all these are components of yoga. Yoga includes all this, and all this is interlinked. So it is not any single thing that comes in, but yoga involves the practices of the body. The body never functions alone. The body, along with the body, the mind is involved, because it is the mind which mobilizes our body. Along with it, the breath is involved. So it is all very interlinked. And, to ask a person who is stressed to say, do not get stressed, it is going to be a very difficult proposition, because more you say don't get stressed, they're going to get more stressed. It is as simple. If a person is getting slightly irritable and we tell them that don't get angry, the person will get more angry. Finally, the person will be so irritated with all the conversation that they will lose their temper. And it is us by telling them don't do it. So if somebody is stressed or feels stressed, and say, no, don't stress, everything will be okay. Don't stress. That will add to the stress level. So we need to do something to calm the mind so that stress is relieved. Now, the question is that today, as I said, first we need to measure the stress. Second, we need to see whether stress really comes down, because it's all about perception. So if we were just talking to people, they say, yes, I feel very good after doing yoga. Well, good for the person. But if in terms of science, if in terms of medicine, we want to prescribe something, when we surely need evidence to see that, yes, there is definitely a difference and that stress levels have come down. So these were studies which have been done and which have used the classical scales for assessment of stress, which are validated scales by the psychologists. And here they found that the women who perceived emotional stress, and they kept them in the waitlist and yoga group. It's important that here it's a waitlist group, because otherwise one will say that the fact that they wanted to do yoga got their stress levels down. Here they found that there was a significant decrease in perceived stress, in trait anxiety, depression, and there was increase in vigor, which was published, and I'm talking only of papers published in scientific journals. Now, here is another study. Again, they looked at perceived stress, and within 3 months of practice, their stress levels came down quite significantly. As you can see, from 4.7, and the yoga group, it sort of, there was a decrease of minus 4.7. There was a decrease so much. And if you look over a period of time, it decreased further. So you can see between the control and the yoga group. So from a state of distress, they came into a state of de-stress. So now we, one second, I'll just have to mute people. Yeah. So then as we move further, what we find is that, is there any more evidence? So they looked at young adults with anxiety and depression, irrespective of the cause. You can see that the back depression is a very popular scale. And over a period of time, once this is the pre-test level, and you can see in the control group, there is no change. They remained the same over a span of 3 months. But in this particular group, which started yoga practices, it came down in a span of 3 months. And then over the 6 months, it came down. And when you look at anxiety, there was again a very significant drop in anxiety following the practices of yoga as compared to the control group. So all this shows that yoga does help in overcoming perceived stress, anxiety, as well as depression. Now, looking at the moods of people practicing yoga, you can see the pre and post value. So the sense of happiness, so whatever the positive mood stress has increased, a state of relaxation has improved, an optimistic approach to life, a sense of confidence from 2.8 to 3.4, and sense of feeling a contentment in life. While if you look at that negative stress markers, you can see that there's nearly a 40 to 50% decrease in a feeling of stress, a feeling of sadness, frustration, irritation, depression, anxiety, a sense of feeling blue, anger, and pessimism. So you can see all these traits have decreased over the time by the practice of yoga, and the moods change. So the fact is that while we do not have a control over our environmental conditions to a great extent, to our surroundings, we do have a control over our own body, where we can not be affected by what's happening around us. So now if I say that yoga decreases anxiety, it decreases perceived stress, it brings people in a happy mood, it decreases depression, symptoms of depression, what exactly is the yoga that I'm talking about? So when I talk about yoga, I will try to say that practice of yoga actually starts by yourself. So if we are sitting, most of the time, wherever we are sitting, we are not really observant about our whole body. How are we sitting? Are we leaning to one side? Are we tilting to one side? And is the body going to affect the state of the mind? And if we go back in time, especially the older generations, we do remember how our parents would ask us that to study, sit straight. Don't lie down and study. The mind is alert when you sit straight. So the sitting affects your state of mind. Now, if we were to say, there is a strong connection between the body and mind. So if somebody sits with a collapsed chest, drooping shoulders, this is an indication of a depressed mind. Those who have read fiction would very well know that if they want to describe a depressed person, they will say a person with a collapsed chest, sunken shoulders, etc. So when the chest is well lifted, the mind is also lifted. Now, sometimes when one is very anxious or when we are very worked up, we will find that one sits pushing the head on the palms, a sign of as if we are thinking deeply. That is a state of a very anxious mind. So the position of the body alters the state of the mind, and it is easier to alter the state of the mind through the body than directly with the mind. So like I said, if a person is angry and you keep saying don't get angry, it is not. If a person is thinking and very deep in thought and tense, and you say don't think, don't think, don't think, you will think more. The more you say don't think, you're going to think more. The more you say be quiet, your mind will get chaotic. So the mind cannot be directly approached by the mind. The mind can be approached via the physical, physiological body. Now, there is also a connection between our breath and the mind. And very often when we are teaching, you'll say, take a deep breath when the person is. Now, what does it really mean? So when somebody is anxious, if somebody, there will be shallow breathing. We'll say butterflies in my stomach. That's a phrase which is used. So the breathing becomes very shallow. Supposing somebody is very depressed, their breath is very short. Supposing somebody has seen a tragic accident, we will unknowingly hold our breath. You just stop breathing when you see something. So you say, so these are the states of the mind reflected in the breath. If somebody is very calm and serene, the breathing is very soft. You see, when somebody is very tense, their breathing becomes hard. The neighbors can also hear it. So these are how the breath, mind, and body are so strongly interlinked. So we can work on the other through any one of them. So body is also strongly affected by the endocrine system. It's all interlinked. So while we practice, the easiest of this all, to control the mind, to modulate the mind, we work on the body, the mind gets modulated. Now, what do I mean? So there are different yoga asanas which are being taught. And don't worry, yoga has nothing to do with flexibility. In fact, if you are stiff, you have a better understanding of the body. We can use supports. So when the head is taken down in the poses shown below, and that, of course, anything that you study or you practice, you need a good teacher. You need somebody to guide you. But once done, these bring a sense of calmness to the practitioner when the head is actually lower than the heart and the stressors of the brain start coming down. So sometimes, if somebody is very tensed, all one needs to do is stand straight, extend the trunk, and rest your forehead on the table, which is a good height. And the moment it is there with your arms, the brain starts quietening down. The mind starts quietening down. Then there are the inverted asanas, which like magic work. Now, there will be people who have never practiced and will say, oh my God, just looking at this makes me very stressful. You expect me to stand on my head? Impossible. I have started getting palpitations doing this. Again, with a trained person, it is possible and it can be done by anybody. But anything that you do, you need somebody with sufficient experience and qualification to guide you. There is a strong connection between the psycho, the neuro, and the endocrine system. And also we in the yogic practices talk about a good connection between the endocrine, the abdominal and the emotional state. As I said earlier, butterflies in the stomach. We hold our abdomen, we grip our abdomen in cases of tension. So asanas and postures like this immediately relax the abdomen gets extended. And I can talk not in basis of evidence, but in terms of experience, that moment people are put into these kind of postures, immediately they quiet them down, immediately they feel relaxed. So of course, there are certain adjustments. It's a science, and you cannot expect anybody and everybody to just try to do it. You need the guidance. But these are the asanas which really help. And also there are the supine asanas. In all these, as I said earlier, a lifted chest. So even in a supine position, when support is given underneath the spine, it starts doing this dual purpose. So the chest is lifted while the head is quiet and the person gets relaxed. And in case people have any other health issues, we are in a position to modify and add certain supports to get them to do it. So yes, and when we do these asanas, there is a change in the state of the mind of the practitioner. And especially when done regularly, it starts transforming the individual and the actual change starts occurring in the practitioner. However, there's a word of caution. Every individual's body is different. So even if we have medications, we do know, because today with popularity of yoga, somebody says, if I do yoga, it will help. It is like saying, I will take medicine, it will help. It depends which medicine, what dosage, how it is taken, the sequence in which it is taken. So that is also applicable here. One has to understand the constitution of an individual. The principle remains the same, the fundamentals remain the same, but the asanas are slightly modified for that individual. After that, one has to be in control of the capacity of the individual, because people are of different ages. So we can't give the same thing to everybody. It is like saying we cannot have a fixed protocol. There can be a guideline to the protocol. So you can't say an 18-year-old and a 40-year-old and a 60-year-old will do the same thing. That will not work. It's like saying I give the same diet to people of all ages. It needs to be individualized, and it cannot be learned overnight. It takes, even for the effects are felt, the effects will be lasting for some time after the practice. It's only when it's done regularly that you find the impact of these effects. And one needs to learn from a highly experienced teachers, and not teachers who are sitting on a platform and going to teach, but teachers who practice themselves and experience. So practice is very important because it's an experiential, subjective subject which needs to be transmitted. And you need a teacher who cannot just pick up prescriptions and transfer it, but can give right descriptions to guide the person to get the desired effect. So with this, I would like to end paying my respects to my Guru Yogacharya B.K. Iyengar, who in the last century actually revived this entire subject of yoga, and he brought in the use of props and supports. So today when people use a yoga mat, it is believed that if I have a yoga mat, I need it for doing yoga. The fact is, one never ever used a yoga mat anywhere in the world. It was his innovation when people were slipping on certain floors. They did not have a grip. So along with that, with many props, which today has made yoga a nearly $6 to $7 billion industry just from the sale of props. However, the yogi in Guruji B.K. Iyengar clearly said, when they was asked, why don't you patent the props? He said, did the Rishi Munis patent the subject? The subject is for all. So how can you let everybody learn? So irrespective, for a PCOS patient who may have health issues, they can all try to the practice. All you need to do is find somebody who is experienced enough to guide you. So yes, then stress can be, the whole distress of stress can now become a de-stress state. So with this, I end my presentation, and over to you, Dr. Sushma and Dr. Surveen.
That was a wonderful talk. And I think you just simply covered everything about not only yoga, about a lot of other things. I liked your comment on, every practice has to be constant to show an effect. And I can vouch for that if you're not constant in a practice and we expect results to occur, they don't occur. Even with yoga, like I'm a big fan of yoga. I do yoga every day in the morning for 1 hour. I do my pranayam and breathing exercises after that. And I actually feel there is nothing like yoga, because you feel on top of the world after you finished it. I used to be a gymmer, and I can tell you that yoga is 100 times better than going to the gym, because it kind of, stimulates each muscle. It causes you to stretch your whole body. And at the end of it, you're actually feeling very well. There are also, and I'm sure you've read them, there are scientific papers on this. There's a very recent meta-analysis which has come in 2021 from the Department of Ayush in Rishikesh, which has, I think they've said 11 experimental studies, and there were actually 2 randomized controlled trials on just yoga and PCOS, which showed a very positive effect. So we are not just talking only experience, we are talking evidence also here. Although I know Rajvi has a lot of experience of yoga, and she herself is very much into it. I think the yoga has also been shown to increase sperm counts. This is another place where it has helped where sperms have been DNA damaged, which has improved the sperm count. So I congratulate you on this talk. I think it was a wonderful, wonderful talk, and people have to get more aware of this. So you should actually be having public forums on this. This committee should join hands with the public forum committee and do a few programs. So it's very good. Thank you. Thank you for having me.
We'll be having this type of program with other societies also, ma'am. We are planning to have.
Yeah.
It does increase the awareness so much.
Yes, ma'am. Very well said, ma'am. You have wonderfully discussed the role of stress in PCOS and endocrine disorders, and the stressing role of yoga in management of PCOS, which was by reducing BMI and reducing the stress, increasing the muscle strength and restoration of HPO axis, and increases the insulin sensitivity. So by managing PCOS naturally by yoga, dietary modifications, and other things, all the women suffering from PCOS tend to gain much greater understanding about and appreciation about their body, and which is certainly a wonderful bonus for them. So thank you very much, ma'am, for a wonderful lecture. I'm always fan of yours. So it's always nice to hear you.
Thank you. Thank you. Thank you. So,
Thank you so much, all of you. I will request everyone if anybody want to ask any question.
I guess there are no questions in the chat box,
Yeah.
but otherwise,
Lectures are wonderful.
I have one question to Rajvi.
Sure.
Rajvi, it is basically the back stretches which are helpful and the head down position, right? That's what you said.
The head down position, if done correctly, it absolutely helps in the relaxation of the brain. Also, we have this pose called Sarvangasana. But again, if people do it independently or not, then they could strain their neck, because after all, you're molding. So with support. So primarily it's the inverted positions, the stretches. So it's a little of everything. So to get into the backward bending positions, you need strong legs. So we do the standing asanas first. So that gives you the strength. Otherwise, people will just curve from the lumbar and get back pain. So once you have strength in the legs, then we go for the inverted positions. Then we go for the sitting and supine positions. And then one can go for the curvature, like the back. And then finally, one ends with Sarvangasana, Shavasana, and then a little bit of pranayam. So again, that adds on to the state of relaxation.
So do you do yoga, or is there somebody coming to?
Pardon?
Do you do your yoga on your own? Or is there
Yeah, actually, I have been doing it now for many decades, literally. So I have been practicing myself. I also teach in Mumbai. So we have a youth center. So I teach across thing for many years. So in fact, I'm part of the advisor to the Ministry of Ayush for their projects, etc. Been very deeply involved in yoga.
Sometimes patient came to OPD and asked him, ma'am, which yoga is beneficial for PCOS.
So see, I think, so I think what is important is that to direct them to teachers. And now I think the pandemic has done something good, is that you have online classes also. So, where you have a good person, because it's like saying which yoga is saying which medicine, but it doesn't work in isolation. So like if we say we have to do the backward bending, if they just do that, the body needs to be prepared to do that. So it is always good to guide them to a right teacher, and then they start practicing. So because see, if somebody starts today, the body is not toned. So we will just get them to do very simple things. So the body gets a little toned. Then we go. So even if I talk about an inverted asanas, you're not going to teach it even to a apparently very healthy person on day one. It takes time to build them up to that state. So that would be the things. So these are some, so it depends now, if they're feeling stressful because of that, and then we'll get them to do all these different asanas. So supine, backward, and inverted primarily.
My question to Shalini ma'am. Ma'am, in routine prescription, we are having, in cases of PCOS, we are having prescription of COCs, prescription of chiroinositol, D-chiroinositol, metformin, and vitamin D, and some multivitamin.
Yeah.
What you do in your practice, ma'am, if you are treating a patient of PCOS, and she is coming with 4 or 5 previous ultrasound report having PCOD in all reports. She says कि madam मेरा तो ठीक ही नहीं हो रहा है.
Yeah.
How
So-
will you manage?
Yeah, Dr. Sushma, it's basically the entire lifestyle management which we guide to the patient before we jump to the drugs. The first and the foremost important thing that I tell them is that they need to have a regular exercise. And regular exercises in general, if we talk about that, they need to have 10,000 steps, maybe thrice a week. Having said that, it doesn't mean when a patient comes to me and I straight away tell that patient, ki, okay, from tomorrow you jump to and start doing 10,000 steps. No, it's not that easy. They have to move on gradually, because whatever the form of exercise, be it brisk walk, be it jumping, be it skipping, any form of exercises, be it like cardio, strengthening, muscle strengthening exercises, these are very, very important because they help in improving the number one, the blood circulation. They help in decreasing the insulin resistance, and they also help in correcting the hormonal imbalance. So the lifestyle modification, I lay so much stress on this, and straight away, right at the first sitting, I mean, I give metformin a very limited, only the conditions where I highlighted, if the patient is obese, BMI is more than 25, or there is a history of insulin resistance, strong family history, and she is not responding maybe like to clomiphene and all, then only I jump to these drugs. But first is the lifestyle modification along with the dietary change in the dietary habits, which Dr. Ritu highlighted and in a very great detail, and Dr. Rajvi took up the yoga. So it's actually a comprehensive approach which the patient has to take. Coming to the myoinositols and the chiroinositol, I still do not prefer them because they are still experimental. There has to be a particular ratio of myoinositol and chiroinositol, maybe I think in the ratio of 1:40, which probably it's very difficult to have it in the medicines right now. So my choice, if metformin at all is required, I mean, if these insulin sensitizers is required, is metformin, because I still keep them as the reserve and still as experimental. And this is how I go about it. If the patient is coming for infertility, then certainly ovulation induction drugs, where letrozole takes as the first line of drug of choice for the polycystic ovarian patients.
May I add something? So the regular and persistence exercise itself makes a favorable myoinositol d-chiroinositol ratio. So the ratio correction itself happens once the exercise and yoga and everything is there in place.
Yeah, there is a question in the
All
chat.
international consensus have also said this only 6 months. The problem is 6 months of lifestyle and diet. The problem is the patient doesn't want to wait that long and they keep jumping from one gynec to another gynec. So problem is there.
Very true. Very true. Dr. Sarveen, any comments from your side? And Dr. KD sir?
In fact, when we were given this SIG, we thought, what will we do in this? Dr. Rajvi remembers very well. But then we started digging into it and we found that there is yet a lot to discuss and lot to discover.
Very true, very true. Actually, this needs a lot of awareness, like the yoga, the diet, the healthy yoga and the diet. I mean, you can't learn yoga in a day or so. It has to be under proper training. And this certainly has a long way to go, and this certainly benefit the patients.
Actually, everybody would agree with me. Like our publicity campaign cannot be larger, bigger, and mega like other companies have sold their products. So it needs a real, public forum awareness, which will take probably quite long to reverse the things which have already happened, right?
Yeah.
One question in chat box is there: how long we can prescribe OCPs to young girls? For how long?
Okay, I'll answer. The birth control pills in the young adolescent girls, probably I did mention it in my talk also, not more than 2 years, but if she requires, maybe we can give it a break. But however, if she is married and looking for a contraception, then maybe it can given for a longer period of time.
But and whenever we start, we give a gap, reassess the patient after 1 month, then 3 months.
And before we start, because
Look
I think
for,
many
DVT.
apart from the doctors, the general public people are also there. So before we start the birth control pills, we have to take a detailed history that the patient is not diabetic, hypertensive. She doesn't has any history of thrombosis or any family history, smoking. These days we are finding young girls, the smoking is on the rise. So please, from your own side, just do not Google and start prescribing the birth control pills. It has to be under supervision.
Thank you.
KD sir and Dr. Surveen, anything more to add?
I think it was a very thought-provoking webinar. I think we need to think of things other than medicine for patients, especially these chronic diseases like PCOS and all. You can't keep giving them medicines; those are just shortcuts. And that's why I said that this webinar needs to go place to place so that everybody gets a little more aware of these things. I also feel that there should somewhere be a patient help group. That these things are lacking in India. If there is a help group which guides the patient, kahan jana hai yoga ke liye, where do you access, the right foods, whom can you consult? So making that help group and starting that culture in India is very, very important. That's one thing we are lagging behind with the West. And PCOS is such a group that it does require a help group because of low self-esteem, poor body image, stress, then infertility. So I think this initiative can be taken on starting a help group. And I would say all three talks were excellent. Each talk was different on a different subject. Shalini beautifully got out all the myths and which was so much needed because there are people who still believe that, yes, these things are happening. And the answers to, after busting the myth, what is the right thing? And so did Ritu. Her talk was very, very informative on, the endocrine disruptors which are coming in. I think, maybe the talk was so provoking that one should just have a webinar on endocrine disruptors because they are all over. In each and everything we are touching, there is an endocrine disruptor. So we really need to know which are the ones which are very, very toxic and which are the ones which are less toxic. And in fact, I was just telling my daughter, she said that, she uses sunscreen every day because she says you never age. And I told her, I said that, you don't know what all endocrine disruptors they are in the sunscreen. Stop using it. So these things which we are using every day, we don't know what it's doing to our body. So thank you so much for having me here. It was a pleasure and it was a very good webinar.
Thank you so much.
Thank you so much, ma'am. Surveen ma'am, Dr. KD sir, everyone is, thank you so much for coming here and giving us time. And thank you so much, SIG Holistic Medicine. And we hope we will meet again in another webinar in the future.
Yeah. Thank you so much.
I read that we are using, average women is using 570 microplastics or 570 these products which are not good for us every day in our cosmetics, in lipsticks and eyebrow, this thing, pencils and whitening agent and sunscreens and creams and oils. Almost 570 products are there which are not good for us. So seeing that, one gets really scared that what we are doing to ourselves.
Yeah, these EDCs, they are actually, they are eye openers and they are scary. I mean, the moment you realize they are like kind of omnipresent. They are present in plastics, whatever you do, they are present in your plastic paints, house paints, everywhere they are there. And you read it and you get scared. The kind of environment we are living in. And with this, I think we come to the end of the session, and I sincerely thanks KD sir, Dr. Surveen, and Dr. Prakriti, the Chhattisgarh chapter, Dr. Priya, Dr. Sushma, for giving us this opportunity to do this webinar. Hoping to see you all again, and special thanks to Atul from the tech team for coordinating this, and sincere thanks to all the present.
It's our proud privilege for TT chapter of IFS that we are having such a wonderful speakers with us.
Thank you,
Thank you so
everybody.
much for coming. And
Yeah. Thank you so
It
much.
was a pleasure, and we are happy to see that in the live webinar now, gradually the numbers of people who are attending increasing. And we also
Yeah.
have a lot of views once we put it up on social media. So gradually the awareness is spreading, and we hope we can get the message across as Dr. Surveen suggested. So thank you so much.
Thank you,
Okay.
Dr. Rajvi, also.
Yeah.
Okay, thank you, ma'am.
Thank you. Thank you,
Thank you
everybody.
so much.
Thank you.
And with
Bye
this,
bye.
we all take a leave.
Yeah. Thank you.